For our group project, we decided to do herpes.
I'm Katie.
I'm Kaitlyn.
I'm Reagan.
And I'm Koltin.
Starting off, we have some basic characteristics of herpes. It is most commonly characterized by painful blisters and open sores that can be inside of or surrounding the mouth and the genitals. These blisters are most commonly fluid-filled. Once an individual is exposed to disease, it will usually take anywhere from 1 to 2 weeks for symptoms to appear. However, many people go months and even years without having knowledge of being positive for herpes. It's mainly asymptomatic, but when these symptoms do persist, it's generally manifested through these open sores that were mentioned to the left. A person with herpes might also present with flu-like symptoms such as fever, chills, fatigue, and body aches. Another thing that a person with this disease might experience is swollen glands. This can happen anywhere where glands are commonly found in the body, things like your armpits, your throat, your genital area, and these glands tend to be tender.
So the agent that causes herpes is HSV, which is the herpes simplex virus. There's HSV1 and HSV2. HSV1 is spread mainly through kissing and oral sex and is manifested by herpes on the mouth and neck. HSV is spread through vaginal, anal, and oral sex and manifested by herpes in the genital regions. The structure of this agent is spherical and ranges from 155 to 250 nanometers. It has viral double-stranded linear DNA and has a unique 4 layers. There's the core, which has the genome, and a capsid that encloses the genome. And then there's a layer made of an amorphous protein coat around the capsid, and then a glycoprotein lipid bilayer envelope around it all.
Herpes is acquired from skin-to-skin contact with another individual who is positive for the disease. A person can get herpes from kissing and partaking in sexual acts, such as vaginal, oral, and anal sex with a person who is again infected with the disease. Herpes enters the body through 2 ways: open skin injuries or lesions, and mucous membranes. There are no environmental factors associated with the disease because thankfully it cannot live for a long time once it is outside of the body. This is why it can't be transferred through toilet seats, sinks, or anything in the bathroom, like showers, that many people think that it possibly could be. It has a survival length of a few hours, but it can be up to 8 weeks. However, it only survives when it is on dry, inanimate surfaces, and toilets and sinks are generally wet, so they do not provide a good surface for this virus to live on.
So diagnosing herpes depends whether or not it is in the genital area or oral area. For genitals, it can be diagnosed by looking at any sores that may be present. Along with that, providers can take a sample from the sores and test it. For the oral area, it can be confirmed if it is herpes through confirmation with the virus culture called PCR, blood test, or biopsy. How is herpes distinguished from other diseases? Herpes can be distinguished from other diseases as it has an appearance of white, yellow, or red translucent sores or bumps that are filled with clear liquid. For the genital area, it is often confused for genital warts, yeast infections, or even ingrown hairs. For the oral area, it can often be mistaken for an allergic reaction.
When it comes to the severity of the disease, HSV1 is at a minimum risk to any patient's health. It does have a very high infection rate, but the most the patient will undergo is mild discomfort with the sore that is present on their lips. Whereas with HSV2, it is a greater risk to the patient's health. Again, it still has a high infection rate, and it can spread to a baby that is born if the mother has herpes. Also, it has you at a higher risk to contract other STDs, and you also may contract meningitis in the process. Currently, there are no cures for the herpes strain. Most treatment options are to stop the spread and to stop any major outbreaks. Oral herpes treatments are mostly cold sore ointments and creams that can help diminish the outbreak sooner. And genital herpes treatments are mostly antiviral viral medications like acyclovir And in current research, the Fred Hutch Cancer Center published in 2020 that they actually have effectively eradicated 90% of HSV1 latent virus cells in nerve clusters in mice using gene therapy. And at that time, they had stated that they were at least 3 years away from human trials, which means that we are hopefully in the time when they are able to actually possibly cure herpes.
So some not so fun facts about herpes. There's 1 out of every 5 adults are diagnosed with herpes, which is a lot more than people think. And that also has to do with the fact that symptoms can take days to years to even ever appear. So it also has no cure, but it is manageable with the like topical ointments and antiviral medications as previously stated. And a person can also spread their own herpes to other parts of their bodies.
And then lastly, we have our resources. And that is it.
Thank you.